So welcome to our webinar tonight on the National Health Services Directory, the NHSD. I'm Katrina Otto from Train IT Medical, and this webinar is the fifth in a series brought to you by Allied Health Professions Australia, AHPA. AHPA is working to support you on your practice software and digital health journey, and this series was developed and funded to help practices navigate the world of technology options, to look at what benefits you might get from using practice systems and how you may integrate different elements of digital technology in your practices. So all the webinars that we have done so far have been recorded. They are available on the ahpa.com.au website with additional resources. They're available to any allied health practitioner, and you can see here I've put a link to the AHPA website, and here's the 4 previous webinar topics that we did. So these webinars are designed to build technology use and support you as we progress in this digital era. For those who didn't perhaps listen in to the previous series, I'm Katrina Otto, and I have been working in practices for the last 30 years, but for the past 12 I have had my own practice management consultancy. So I am an approved trainer, I'm a medical software trainer and a consultant, but my goal is to increase and improve the use of digital health technologies to make your life a little bit easier, to improve benefit the patients as well as the wonderful people, that would be you, who care for them. So my mantra is you can use any software badly, let's choose well, and let's use it to make your life easier in this digital era that we're in. So tonight we'll be talking about another of the benefits of digital technology in being able to easily share your information in a directory that will be available to patients as well as healthcare providers. So I'm talking tonight about the National Health Services Directory. We call it the NHSD, and I'll be talking about what is it, how is it currently used in healthcare in Australia. Let's look at the benefits, how you participate and how you actually use it, how you can register your practice if you're not already in the directory, and also maybe identify ways to incorporate the NHSD into your practice website. If I can just stop for one moment and get everybody to type into the GoToWebinar side panel, just let me know with a yes or no if you actually do have a practice website. I think that would be really interesting, and that way I'll be able to know if this is something that you might be interested in. Okay, almost. I got an almost. Fabulous. So getting about 50-50 now. If you don't have a website yet, there's a good goal for the new year, especially if you want to share education or connect with your patients or clients, even attract more clients. So we'll see a bit of that tonight to talk a little bit about how you can use this directory to increase your visibility. So let's have a look at what it is, first of all. So the National Health Services Directory is the leading source of information about Australian health and related services. So this is a national Australian directory. So it's a joint initiative of all Australian governments, and it's developed and delivered by Health Direct Australia. It was launched 4 years ago. I think it's quite amazing, a joint initiative, all governments, and we really needed a managed directory, as accessing accurate, up-to-date information about services, providers and organisations is absolutely vital for efficient healthcare. Before 2012, when this was established, there were all these independent directories trying to provide access to health services information. So they seemed to cover only certain types of services or certain geographic areas. So we have a national directory, and we need this. We need this to support the growing national digital health infrastructure, or as I call it, the ecosystem, digital health ecosystem that we're building, and that will connect us all. So it's important that this directory exists. It's important that you're in it and that your information is accurate and up to date so that people can find you. So This presentation, the recording, as I said, is available for you all. This presentation in PDF format is also available for you all. And what I've done within it is included links everywhere. So as you look, if you wish to find further information, you can click on the link. And the two important websites I will be talking about tonight mainly are the nhsd.com.au and healthdirect.gov.au. So I might just quickly go there and bring that up. So that's what you can do in the presentation too, the National Health Services Directory. Now, what this is a directory for health professionals and consumers as well. As I said, it's a national directory. All governments are committed to ensuring it's accurate and up to date and supports the digital health infrastructure. But I highlighted what's most important here tonight is it has all health services, and you, of course, play such an important part of that, and it really needs your help to have accurate information about you all. So this is timely tonight. Please know it doesn't include names, just practice details, but does include essential service information such as location, opening hours, telephone numbers, and my favorite topic, my health record accessibility. So I'm just going to have a quick look again and see. Let me see. We've got a lot of occupational therapists, orthoptists, exercise physiologists. We've got quite a mix of people attending tonight. I'm just going to go back to that National Health Services Directory. So nhsd.com.au. And this is actually what we call a widget. Okay, it's a searchable directory here, accessible to patients and healthcare providers, and most importantly, general practice, pharmacy, emergency department, hospital, but more services. So this is what we want. We want more services. Hit the plus. Now, I would like to find let me think. I would like to find an exercise physiologist, and I will have a look. Let me see if I can find one in Sydney. So that is an additional search that we can do to fine tune it even more. And I'm going to search. So the idea of this, I'll just do a simple search to start with. Sydney. Okay. So Sydney having many postcodes, of course. Search. There we go. So this is now bringing up, oh look, good to see. Allied health professionals have gone home for the night. This shows you the practices, whether or not they are open. There's many, and where they are. So giving you a map as well. We can see here who does home visits. I can see who does home visits here, and I can see who does online or phone consultations. So telehealth consultations. So 50 nearby me, some of them my health record compliant, and some of them do home visits and online. So how fabulous is that? So that is the National Health Services Directory. The goal now, we know how to access it, nhsd.com.au. I'm going to talk about how you can even access it on a mobile app, tablet, how you can have a widget on your website. But first and most importantly, we need to have you on there. So you can go to the nhsd.com.au and you can, I'll show you how to register. You may want to look first and see if you are already there. So I've put the link here, and there's the link to register. If you would like more information, you're welcome to email the team, and they're very helpful at Health Direct. I was talking to Chris Harwood from Health Direct this afternoon, who was enormously helpful. So it is a commitment to ensuring this directory has accurate and up-to-date information. How is it kept up to date at the moment? Well, the Health Direct team, they contact you all. They contact providers, they verify and update. And as I can imagine, that's quite a challenging job. So therefore, self-authorship probably is going to be much more effective, where you update your own information and ensure it's accurate if you make changes to your practice. It also does cross-reference and sync with other validated data sets. So I'll talk a little bit how there are, a Health Direct is a big organization. It manages many directories. Chris told me today they get 250,000 hits on the directory content every day. So it is, Better Health Channel. There is a lot of connectivity here with, multiple directories, with hospitals. It is important that this information is updated, and allied health professionals, I have to say, probably is a contributor that really contributing service provider that really does need to have information updated. Reminder notifications, will also be part of it, but I'm going to show you tonight how you can register and update your own information. So benefits patients and healthcare providers. I am all about integrated care, ensuring that, we have, a healthcare home for our patients at the moment. So having information available for them, empowering them. This is all a great way to build that connectivity with our patients. Helps promote the availability of your services, of course, and how to contact you. Improves health literacy, because this also has a component of patient education, patient information, which I'll show you. And I wrote this one. Improves engagement with your patients and demonstrates that you are using modern digital technology. And I think this is really important. I am not young, and I think it's very impressive when I see that there are allied health providers who are providing services rather than the one model of practice-based care, having options. And many of you probably do that, but is it visible? Can we find you? Can we see that? So the benefits, there's a Health Direct app, a free app. Patients can download it. You can download it. It enables you also to easily find other health providers in your area. So this is really important from the perspective of GPs finding you. So this directory enables healthcare providers to find each other. I can say, where are all the optometrists near me? I can find them here. There's even Google Maps. I can say, who is connected to my health record? So can I just have a bit of a yes or a no for whether or not any of your practices have connected with my health record or heard of my health record? Fantastic. Yes, thank you, Dana. That's wonderful. Okay, so I would really encourage everybody to have a look at the previous webinar that we did that's on ahpa.com.au. You may not have heard that next year, 2018, mid-year, there will be a big My Health Record expansion program with the announcement by the government that it will be an opt-out. So the expansion program, all Australians would be advised that they can have a My Health Record created for them if they wish. So this is going to become much more of a big topic next year, and the point of My Health Record is to streamline communication among the patient's entire healthcare team. So it's not just about general practice. There's not a great deal of point general practitioners talking to general practitioners. It's allied health professionals, specialists, hospitals. It's all the healthcare providers. So that is what My Health Record is, an online summary. So rather than faxing information to each other, we will communicate securely with secure messaging, which I'll talk about in a moment, and of course uploading summaries to My Health Record. So have a look at that. But as you can see here with the National Health Services Directory, if I was to look up, and I'll just go back to the actual site, if I was to look up, I can see here Crown Street Medical Centre is My Health Record, Chris O'Brien Lifehouse, and that is a fabulous example of My Health Record success story. So if somebody is having chemotherapy, a discharge summary, it will be able to be seen and uploaded. So connecting people with, significant health needs, and that is the point of it. So we can see, it may, I don't know, but there may come a time when patients use My Health. Are they connected? They'll have my information. Is this going to be a contributing factor for our businesses? I don't know, but it is certainly something that is going to be much more in the forefront next year. It's a good time to be thinking about, are you digitally connected in your practice? This is a good start. Getting on the National Health Services Directory is a very good start. Now, again, I've put all the links in here in the presentation. I've put a quick link in for you can do an online application. And I don't know if any of you are asking the question, but I certainly asked the question, how does this My Health Record badge get on there? What is the point at which in the directory it gets on there? And apparently, when you complete your application, when a provider registers for My Health Record, and allied health professionals, if you have a health practitioner identifier, HPII, so with AHPA, if you can become a registered provider for My Health Record, complete the process. The Australian Digital Health Agency is there to help you with that. Also, for those of you who aren't registered with AHPA, if you are with your association, there are still channels from which you can become a registered provider for My Health Record. And that process, register, is here. So that's ensuring that when you are connected to the National Health Provider, National Health Services Directory, you will be seen. It is a National Health Provider Directory that's integrated into Health Direct's Australian National Health Services Directory we're talking about tonight. So this is building, I think, the National eHealth Address Book, really. We do want to stop using paper. This is a big goal to have secure interoperability. The My Health Record system is working. We have through the NHSD, they have what they call a national endpoint proxy service. I won't get too technical, but the design is facilitating secure messaging to and from the hospital sector. What we're now still working towards, and those who listened into my previous webinar talking about secure messaging, what we are now working towards is more meaningful use for those of us in the coalface with interconnectivity with our secure messaging. And that's about getting the providers connected. They are testing that at the moment. There's a lot of work taking place, a lot of trials taking place, and the National Health Services Directory is an important part of all this. So ensure you are on the National Health Service Directory and your information is accurate and up to date. So to register, here's the link. Fill in the online registration form. Have a look first and see if you are in there. When you complete the online application form, you will see the process. I'll just go to the live site. Okay, so if I go to NHSD or Health Direct, we can see there's the directory. Further down, a little bit about the NHSD. Here it is to register your service. Here it is to review your listing. Here it is to manage your listing. Okay, and then if you would like more information, there's resources, privacy information, and you can contact them. So it is having a look first, review, see if you are already there. If that information is accurate, create an account, keep it up to date, put your operating hours in there, ensure that you're visible if you're offering multiple types of services, and then you'll be able to keep that information accurate. If you would like a widget for your website, a widget is a self-contained web application that can be embedded on a website. So what we were seeing there on the National Health Services Directory website, that's a widget in itself because I can search from within that. You could put a widget on your website too if you wanted to. So here's the link to go to the embeddable widgets. There's a contact if you would like more information. And the examples of what you could do on your website, here's one from my good friends at North Queensland PHN. They've got a symptom check widget, so a self-guided triage process. Now, this is trusted advice. So remember, this is just not somebody creating this themselves. It is validated. It's a government site, and this is updated, authenticated all the time. So that's one of the widgets. That's a bit of a better look at it. And then we've also got a medicines. So therefore, depending on what you're doing, that could be of interest to your patients. And of course, importantly, just general health information searching. So the information presented on the medicines page, it's got a description of the medicine, conditions it's used to treat, much better than Google. There's a link to the consumer medicines information describing potential side effects. Also a link to, the Australian Sports and Anti-Doping Authority, so people can find out information if you're working in a sports-based allied health profession, especially that might be helpful. So information about medicines, information about your health, empowering patients, building their health literacy and connecting with them. So there's just a little quote from Exercise and Sport Science Australia, strongly urging members to sign up, saying that business data from the NHSD will be used to populate a number of website search engines to be used by health providers. So this is the public, such as the My Aged Care website. So this is something I also really wanted everyone to know about. So rather than just perhaps seeming like one directory that you're listed on, this crosses over to many other areas. So this NHSD will populate other searches. So you want to be found. Don't be left out in the cold, is what ESSA said. So this is also a message from Chris Harwood at Health Direct. If you're a service provider not funded by the Commonwealth, but you want to provide aged care services, you really need to be listed in this, as those who are funded by the Commonwealth may be on it automatically, but you won't be. So it is really important that all allied health professionals have a look, go to the websites, have a look in here, review your listing, manage your listing, get an account so you can keep it up to date. If you're not there, register your service. So if you hit register your service, it's just about filling in the details, an online form that will be validated, will be checked by Health Direct. They control, make sure that there's no inappropriate access. And once you have done that, you will be on the directory. So that brings me to the end of my webinar tonight. I will take questions in a moment, but I wanted you to know, as I've done in all the other webinars, I wanted you to know that I have included extra links depending on where you're up to with learning and progress. As we said, we have from AHPA the previous 4 webinars on the AHPA website. If you're starting with software, they have a spreadsheet of the available software and features, which has been our most popular resource to date. I've put links in here to how do I apply information about my health record, because I have so much information about it. I've put it all on there for you. And similarly, on my website, I've started a page for allied health professionals. I've collated the top 10 questions I got in the last webinar. I've collated those into a document that I thought it might be helpful for you. And there are also free e-learning modules, My Health Record brochures, and an article about secure messaging, just saying that we're hopefully nearing seeing the light at the end of the long tunnel. Okay, now I will have a look at the questions. If there's anything that on there that I don't get to or I need clarification on, I promise I will get back to you and answer those questions. So this site is absolutely accessible for rural consumers. It's a national directory. As long as you have internet access, you will be able to access that directory. So there is also primary health networks. If you haven't heard of your primary health networks, they are organisations funded by the government to support healthcare providers as part of the My Health Record expansion program, as part of the Digital Health Australian initiatives. They are very keen to engage and help support you. So reach out to the PHN in your area. If you need help with connecting, I will happily connect you. And yeah, so thank you, everyone. I have a comment about the practice. So if you're working in a practice with general practitioners, it's going to be listed as the practice. I get that feedback, but not individual allied health provider names. That's right. At the moment, not individual allied health provider names, but it does say your service and it does say the practice name. So thank you, everyone. I really appreciate you listening and attending tonight after work. I wish you all the best. Please stay connected, and yeah, if we can help in any way, we'll be happy to. Thank you, and I wish you all the best, and I'll talk to you again in our next webinar. Good night.